talk focused on the political scene in Arkansas.
All right, to talk more about the legislative session, joining me now, Keesa Smith-Brantley. She's the Executive Director of Arkansas Advocates for Children and Families. Good to see you, as always.
It's always good to see you, Roby.
Yeah.
Thank you for allowing me to be on today.
Yeah. Are you doing all right up there? I mean, it's tough sledding sometimes.
You know, it is busy. I've lost count, but I do believe I saw something that said there's at least 500 more bills filed this session than we've seen in the past, and so we're jumping right now to keep up.
It doesn't matter how many they pass. There's only so many hours in the day that they'll debate them, and there's only so many weeks left that they can do this. And,
Very true.
We'll see where things go. So sometimes, all right, let's talk about, I think one of the biggest underreported issues in this session is Medicaid.
Yeah.
We still haven't seen some things from either the administration or even some legislators. There is some stuff out there, but you talk to legislators right now. We know that cuts could be coming from the federal government on Medicaid, which would be humongous in terms of its ripple effect on the state economy. What's kind of your assessment of where things are and what you see?
Yeah, so right now we're anxiously watching the House budget resolution for the federal government. By all counts, there's going to be a significant amount of cuts to Medicaid and to SNAP in order to really, achieve what the president and Congress is looking to do, which is to extend, federal tax cuts. So it's extremely concerning. There's a lot of discussion about where they're going to get money for these cuts from. I know there's a lot of conversation about looking to other places. Maybe DOJ will find efficiencies in places. You see all of this restructuring of federal government, but those changes are going to be minimal. They're not going to cover the cost of these tax cuts. And it really is clear by all accounts that the only way these tax cuts are going to happen is that we cut that the federal government cuts Medicaid and cuts SNAP.
Yeah, it does not say Medicaid or SNAP in the actual budget reconciliation bill that they passed, and this is, I think, some cover for some folks that voted for it, which is all of Arkansas's 4 congressmen that voted for this.
Yeah.
But the analysis that you read from any credible source says that is the only way to do it. Can you explain why?
Well, and it's back to where there are other cuts, right? We're not going to, the United States is not going to cut our defense spending. It's not going to see a lot of savings by cutting federal workers or downsizing departments. I don't have to tell you, there's a lot of discussion this week about closing the Department of Education.
Right.
That's one of our smallest federal agencies. Even if you cut it in a fourth, you're not going to save a considerable amount of money. The discretionary spending that is tied to, little projects here and there is not what's going to get the United States.
The big stuff is Social Security, Medicare, Medicaid,
right,
and defense.
Our safety net in the country is what they're looking at. And again, I don't think they'll cut defense.
No, they're not going to do that.
Right.
So, no, as a matter of fact, I think they have money to increase it in there.
Exactly.
As a matter of fact, so I guess kind of walk me through what happens if Medicaid cuts come to Arkansas, and let's just use the number that's out there, $880 billion over 10 years.
Right.
I don't know what the numbers would be for Arkansas specifically. There is some analysis out there on how that could be impacted. It is going to be billions of dollars, though.
Right.
The state's not going to put billions of dollars in to shore that up. How do you think legislators will react if there is a cut to Medicaid spending?
I think there's a lot of legislators holding out hope that this is not going to happen, right? We hear it from our congressional members that Medicaid's not going to be touched because they know individuals are really scared about the prospect of Medicaid being cut. And the numbers I'm seeing for Arkansas say that we could potentially see up to $800 million cut, and that's a low estimate. So to your point, it could be up to $1 billion. Mm-hmm. If those costs are, if we don't get that money, and we're a very poor state, we have we have over 800,000 people on Medicaid.
Mm-hmm. Out of 3 million.
Out of 3 million.
Mm-hmm.
So almost a third of our population is on Medicaid. The big question is, where is the state going to get that money from? And Roby, you and I have talked about, the last time I was on, we've talked about the number of tax cuts that the state of Arkansas has done. we have some very big projects coming down the road pertaining to, educational freedom accounts, the much talked about prison. There's a big question mark as to where we would get the money from to make up for this gap. And if we don't make up for it, what happens to the many Arkansans that rely on Medicaid for health insurance?
Yeah, I think they go into hospital emergency rooms, and then the hospitals are stuck with the uncompensated care tabs, and you see hospital closures is what you'll see happening.
I mean, we've seen the
It's
impact of
happened
cutting
before,
Medicaid
yes.
before.
Yeah, no, it has happened before.
Yeah.
All right, let's turn our attention to, this is something we'll certainly watch because there's still weeks for this to play out.
Right.
And even if they do something that is, in line with what the rules are today, they could always come back in special session if the federal government changes that equation. So let's talk about some things that you have been working on. One huge success point for you this session is free lunches for kids, something y'all been working on for a while.
We have.
And there are broad bipartisan support for this. Tell me what you think the impact of this will be.
It's exciting. It's exciting. So after talking about something for so many years, to actually see it come to fruition was really exciting. And I can't talk about it without really giving kudos to the governor and to Senator Dismang and partners, Arkansas Hunger Relief Alliance, who really spearheaded making this a reality. So it's exciting. And, the reality is that Arkansas was just unfortunately listed as one of the top states in terms of food insecurity, which is not a place we want to be at the top at. And so the recognition from this administration, from our legislature, to say that we want to make sure that kids start off the day as best as possible. We want to get rid of the stigma tied to having free or reduced breakfast, is really, really important and really exciting to see everyone come together and find a solution for kids.
Will it help in the summertime when kids are not in school?
So we still have the summer EBT program that has, to my knowledge, now again, a lot's happening on the federal level, but we hope that that program is going to continue. The governor has accepted those funds, and so she's done it all the time that she's been here. And so we believe that that will continue to be the case, because I do think that everyone can agree that children should not be hungry, and we have to do all that's within our power to do something about it.
Another big success story of this legislative session, you guys get credit, but again, broad bipartisan support for this maternal health. A big package of bills passing through that will change the trajectory of Arkansas's statistics in maternal health.
Very, very exciting. I want to say that we've been talking about maternal health and the problems associated with that for 10 plus years, right? Arkansas was firmly in a crisis. We are now talking about it more than we ever have before. Again, kudos to the governor. We passed the Healthy Moms, Healthy Babies Act, which really did focus on, how we address the number of moms that aren't getting the care that they need. I have to say, because I'm the ED for Arkansas Advocates, there's a lot more work that we still need to do to ensure that women get the care that they need. We don't call it a crisis for nothing. It won't be cured with one piece of legislation, but we're on the right track.
30 seconds left. Taxes. What do you hope happens on the tax front here? Are we going to do more tax cuts, or are we going to maybe have to just hold our breath and not do anything this time?
Roby, we just talked about all of the ways that Arkansas needs to figure out how to come up with money. I know everyone loves a tax cut, right? I'm not mad at folks that want to talk about how we, lower our taxes, but the reality is that Arkansas is going to be asked to do a lot for its citizens in the next couple of years, and we need to make sure that we're financially prepared for that. So I'm hoping, if the legislature is listening, that we will hold tight, just hold for a second, see what the federal government's going to ask before we cut taxes again.
All right, Keesa Smith-Brantley with Arkansas Advocates for Children and Families. Always a pleasure to visit with you.
Wonderful.
Thank you for being here.
Thank you.
All right.